In some ways, they are.
So, and again, this was part of my comment about not putting them in as recommendations, is because we could really go down a rabbit hole discussing this, because there's a lot of discussion, I think, that could be had around this. But I think very briefly, 3 years ago when the Department of Health started addressing this, there were not resources available to us to help message the community and healthcare providers. And so we, working with our partners, it wasn't just the Department of Health, it was the Northern New England Poison Center, the toxicologists there, environmental health physicians in New Hampshire and regionally down at Boston Children's Hospital. We reviewed the scientific literature and we came up with what we felt were scientifically based, evidence-based guidelines for the community and for healthcare providers around what these chemicals are, how to monitor someone's health. Now, there was obviously a lot of concern because people felt like some of these recommendations didn't go far enough. So we looked to ATSDR to try and develop a more standard national set of guidelines for how to monitor someone's health. And they did that. ATSDR, in fact, has, I think in December of 2016, put out guidelines for healthcare providers about how to monitor a patient's health. And after they put theirs out, we revised ours to be consistent. And so there's actually two different sets of healthcare guidelines out there, both of which are, I think, relatively similar, ATSDRs and the New Hampshire Department of Health. But what some members of the community have asked for is what they call medical monitoring. And this comes from the C8 science study out in West Virginia, Ohio, where based on this is the part that gets a little bit controversial, is because doctors like to base testing decisions on evidence-based medicine, but what we have out in the C8 science panel is a legal settlement that identified these probable links between PFOA exposure and health outcomes. And as a part of that legal settlement, there was a panel of clinicians that recommended certain medical testing to identify people that may have developed these medical conditions to be included and have their health monitored and be included in the legal settlement so that their health conditions could be reimbursed. So in that setting, it was part, and I'm sorry, I'm going on about this, but this is part of in that setting, it was based on a legal settlement that medical monitoring was established, and so you have this tension between what's been done in other states, as Stephanie and Shaheen mentioned, and what has been put out currently for healthcare provider guidelines, and that's what's referred to as medical monitoring.
And it's caused,
So,
just to clarify,
Go
it's
ahead.
caused confusion in the community.
Yes.
Because you have parents who
Yes.
have medical monitoring guidelines that they want implemented for their kids who are exposed to contaminated water at child care centers. And they're going to their healthcare provider and they're saying, I'd like my child to have labs done on an annual basis based on this medical monitoring protocol. And the doctor's saying, well, the state guidelines don't advise me to do that, so I'm not going to do the labs.
Right. So Dr. Chan and I have disagreed for a long time about the data that's available to support medical monitoring. And I just want to, I disagree wholeheartedly with his statement that this was based on a legal settlement. The legal settlement, and I want this to be on the record, and then I will come up with a proposal for how we're going to do this. The legal settlement actually funded a 60,000 person epidemiologic study in West Virginia. It is one of the largest and most complete and almost the only of its kind, focusing on a single compound in a single population. The study was performed not by randomly picked experts, but by experts actually picked by the plaintiff. So DuPont was the one who had to agree to these experts, and these panel of experts were nationally recognized experts in toxicology and in the epidemiology, and they came up with identifying the actual outcomes that people continue to say are controversial, but mostly the people who are saying these are controversial are 3M.
Right.
And 3M came out with a review of the literature, which is widely cited. And if you look at the last paragraph of it, 3M had editorial oversight over this article. So when we talk about physicians, we like evidence. We have a 60,000 person study done by multiple experts in the field that came up with very clear risks for C8 exposure in West Virginia and Kentucky. And the only major article that has called this to question that I know of is one that was actually funded by the manufacturer and edited by the manufacturer of the chemical in question. So the science is not as fuzzy as we think. As Representative Mesmer was at a conference in June at Northeastern University, which I was supposed to go to, but I couldn't. So this is not the legal profession telling us what our risk is. These are sound medical studies. And so what I'd like to propose, because we only have 5 minutes left,